Paper is on correlation of Fitzpatrick skin type and iris color with tumor size in 823 patients with uveal melanoma. This study was conducted at Wills Eye Hospital, Philadelphia. So background is a lighter iris color, fairer skin color, larger tumor thickness, and larger basal diameter are all important risk factors in etiology and prognosis of uveal melanoma. And the risk of metastasis and death also increases with increase in the tumor size. So there are studies based on the race, like Asian and non-Caucasians with uveal melanoma displayed a larger tumor size compared to Caucasians. But in these studies, there was no differentiation based on the Fitzpatrick skin type. So in different races, different Fitzpatrick skin type people can be there, but there was no any difference based on that. So we studied relationship between Fitzpatrick skin type and iris color with tumor size in patient with uveal melanoma. So it is a retrospective case series from a single ocular oncology center at Wills Eye Hospital, which included 823 patients. Iris color were divided in blue, green, and brown, and there were 5 subclassification on Fitzpatrick skin type based on the skin color. There were no patient in Fitzpatrick skin type 6. Tumor thickness and larger basal diameter were divided into small, medium, and large. And the correlation was studied using the Kruskal-Wallis H test. So on coming to the result, this result graph is showing relation of Fitzpatrick skin type with mean tumor thickness. So we divided patient in group 1, 2, and group 3 was having 3, 4, and 5 Fitzpatrick skin type. So we noted significant difference in overall tumor thickness, which was larger in group 3 to 5 Fitzpatrick skin type, and they showed a significance. And when we compared Fitzpatrick skin type with largest basal diameter, it also showed significant difference between all the 3 groups. The largest was in group 3 to 5, but we did not find any difference between comparison of iris color with mean tumor thickness, and all the groups were similar. So iris color did not impact mean tumor thickness in our group. Similarly, iris color did not impact on mean largest basal diameter. So all the iris color were associated with similar tumor sizes, but Fitzpatrick skin type 3 to 5 were associated with larger tumor size. We did a subgroup analysis in which we seen each individual iris color with individual Fitzpatrick skin type, and we noticed if patient is having brown iris color and they are in Fitzpatrick skin 3, 4, and 5 group, the tumor thickness and tumor size was maximum, and it was significant. So we found 2 risk factors like brown iris color and Fitzpatrick skin type 3, 4, and 5. So they were having larger tumor sizes. So as written in this summary, there was a difference with brown iris color relative to Fitzpatrick skin type 1, 2, or 3 to 5. So mean tumor thickness was highest in 3 to 5 group, and largest basal diameter was also highest. But there was no difference when we saw in comparison to blue or green iris color. So discussion is a comparison of Fitzpatrick skin type 1, 2, and 3 to 5 revealed differences in mean tumor thickness and basal diameter. So largest thickness and basal diameter we found in group 3 to 5. Comparison of iris color did not show any difference in tumor sizes. But when we compared individually iris color with individual FST, we showed difference with brown iris color relative to FST 3 to 5 with any patient having brown iris color and they fall in 3 to 5 FST were having larger tumor size. So conclusion is patient with brown iris color and FST type 3 to 5 demonstrated larger tumor thickness and basal diameter. Indian population usually falls under the same iris color and same FST type, could be at higher risk of developing larger uveal melanoma. Limitations of our studies were there were more number of patients in Fitzpatrick skin type 2 compared to other groups, and no patient in Fitzpatrick skin type 6. And relationship between FST and iris color was not studied as per HSCC classification. These are my references. Thank you.
interesting paper, but I have certain reservation because is there something called Fitzpatrick 6?
Yes, yes. That usually that is seen in Fitzpatrick skin type 6 in the black population. So
Okay,
we were not having
because
that
if you
population.
see originally when Fitzpatrick given the his classification, there are a lot of you say thought process came thereafter both in the American and European scenario. Now again, because these are all UVA related changes which have happen for the skin and the other things. What is important is that no, there is a amelanotic melanoma. How you explain? Because all these 800, I believe some amelanotic melanoma may be there. How you classify that skin changes with amelanotic melanoma?
So we have seen amelanotic melanoma in our studies, but we did not see any specifically differences in terms of the Fitzpatrick skin type or skin color in patient with the amelanotic melanoma. We have seen the patient who was having advanced Fitzpatrick skin type were more in the blacker side. We have seen larger tumor sizes, and that applies similar to amelanotic melanoma in what we have seen in limited cases. So I don't think there is a difference between amelanotic and normal melanoma in between the terms of the Fitzpatrick skin type, but yeah, we could study that in future in relatively in depth.
Any correlation of these skin changes with nevus or suspicious nevus converting into melanoma?
I don't think because we have not studied in our study the progression of nevus to melanoma, and we usually what is studied is fairer skin color have higher chances of developing melanoma. So my thought process is if we study, we could find more in fairer skin color conversion of nevus to melanoma. And in our study, we have studied tumor size. So tumor size, what we found is more in darker skin color.
Okay, thank you.